Hi, I am Dr. Ajit Kumar. Today I am going to demonstrate lung ultrasound in case of suspected pneumothorax. So first I am picking curvilinear probe and pointing the pointer to the cephalic end of the patient so that the marker matches with the pointer. So I am placing the probe in the infraaxillary space with the pointer towards the cephalic end. So here we can see the liver and this bright line is the right dome of diaphragm. So with every breath, liver is being pushed downwards by the diaphragm due to normal quiet breathing. So once we go one or two intercostal spaces to the cephalic end, so this is the lung. This is the normal way how the lung is appeared on the lung ultrasound. So these horizontal lines are A lines, and we can appreciate one or two these vertical lines. So these vertical lines which are moving, they are B lines. So normally up to 3 B lines in a field are considered normal. So this is how the lung ultrasound appears in a broad way in this when we are using curvilinear probe. Now I am placing the probe on the suspected side of pneumothorax. So we are suspecting pneumothorax on the left side. So I am placing the probe, the same curvilinear probe, in the infraaxillary space on the left side. So what we have to first appreciate is spleen on the left side. So this is the spleen. Spleen on the left side. Once we go one or two spaces, cephalic end. So here, this is the lung ultrasound using curvilinear probe on the suspected side of pneumothorax. Here we don't appreciate those B lines, and you see here this bright line is static. It does not seem to move with breath. Pause. Now I am taking this straight probe, which is superficial probe, and placing the probe in the mammary space just below the clavicle with the pointer facing upwards so that it matches with the marker over the monitor. So on the normal side, this is how the normal lung ultrasound appears with the superficial probe. So this is the rib, and below the shadow is formed behind the rib, and these are the intercostal spaces. So one above the rib and one below the rib. So we appreciate here this bright line which seems like moving with every breath, and we can appreciate this faintly moving vertical lines which are called B lines here also. So I am going to the intercostal space. So this is the intercostal space with this is called pleura. Sliding of pleura is well appreciated here with every breath. This bright line seems like it is sliding. So those two visceral and parietal pleura slide over each other with every breath, which is well appreciated here. This is normal, and we can appreciate one or two B lines which are vertical lines. So this is normal lung ultrasound. I am placing the same superficial probe with pointer to the cephalic end which matches with the marker over the monitor, and placing below the left clavicle which is suspected pneumothorax side. So here this is the rib and the shadow behind the rib. This is the intercostal space. So here we don't appreciate that pleura, that bright line which is seen on the normal side is not seen here, and మెల్లిగా గాలి తీసుకోండి, వదలండి. We don't appreciate that sliding also. There is no pleural sliding. See, this is the shadow behind the rib. This is the intercostal space. We don't see that bright pleural line, and there is no sliding of pleura. No movement of those vertical lines which are seen on the normal side. That means there are no B lines either. Okay, pass. Coming side, I am again placing the probe on the normal side to show you the M mode. So this is the normal right side. This is the normal right side. This is the shadow behind the rib. This is the intercostal space. This is the pleural bright line with sliding. Now I am placing M mode in this intercostal space through the pleura. And how does it appear? On M mode, you see, I am freezing it. You see, this appears like sand in the beach. This appears like sea, which is seen far from the window facing the sea. And this appears like the sky. So this is called sky, beach, sand, ocean, or sky, sea, sand, sand, sky. First. So sky, sea, and beach, the sand appearance is normal lung ultrasound in M mode. Now I am going to demonstrate the M mode on the pneumothorax side. First, I am placing the superficial probe, which is straight probe, on the left side below the clavicle with the patient slightly head up position, so that even if the minimal pneumo is there, the air will accumulate in the upper segments. Now see here. So this is the normal B mode of lung ultrasound on the pneumothorax side. Now I am placing M mode through this intercostal space. This is the shadow behind the rib. This is the intercostal space. Here we don't appreciate that sliding of pleura. Pleural sliding sign is absent. I am placing the M mode through this intercostal space. M mode. I am freezing it here. Here you don't see that granular appearance. This appears like some barcode. It does not appear like sand in the beach. So here you cannot appreciate those granular appearance which is seen on the normal side of the lung. So this is called barcode sign. This appears like some barcode. So two pointers here. One thing, there is no pleural sliding, and on putting M mode, you don't appreciate that granular appearance of sand in the beach. This appears like some barcode. So this is called barcode sign. This is the lung ultrasound in case of pneumothorax. Thank you.